Every day in war zones, healthcare workers face deadly attacks. 10 years after the UN passed Resolution 2286, are these protections working or failing? In 2016, the UN Security Council adopted Resolution 2286, condemning attacks on health care during armed conflicts and demanding better protection for medical personnel and facilities. Yet, reports from the International Committee of the Red Cross show that attacks on healthcare workers and infrastructure remain prevalent across multiple conflict zones. From Syria to Yemen, hospitals and ambulances are still targeted, putting millions of lives at risk. The resolution was a landmark effort, but the reality on the ground reveals ongoing challenges in enforcement and accountability. The consequences of these attacks are devastating. Medical staff face grave dangers, often forced to work in makeshift conditions or flee altogether. Patients lose access to essential care, especially vulnerable groups like children, pregnant women, and the injured. Entire communities are left without medical support, exacerbating humanitarian crises. The ICRC emphasizes that protecting health care is not just about saving lives in the moment, but preserving long-term health systems in fragile environments. One of the biggest hurdles is enforcing Resolution 2286. Many perpetrators of attacks on health care go unpunished due to weak legal frameworks or ongoing instability. The UN and humanitarian organizations struggle to monitor violations effectively. Without strong mechanisms to hold violators accountable, the resolution's impact is limited. This creates a cycle where healthcare remains an easy and tragic target in war. Looking forward, experts and organizations like the ICRC push for renewed global commitment. This includes better data collection, increased political will, and stronger enforcement tools. Technological advances such as satellite monitoring and improved communication could help protect medical sites. The next decade demands urgent action to reinforce the principles of Resolution 2286 and turn its promises into real safety for health care workers and patients alike. For you, this means understanding that protecting health care in war zones is critical to global health and security. Awareness and pressure can drive change. Stay informed and subscribe to Daily Q&A for updates on how international efforts shape your world.